Good afternoon, ladies and gentlemen. My name is Dr. Rakhal Gaitonde, and I come from the South Indian state of Tamil Nadu. I am very proud and happy to be part of the emerging voices of 2012. Today, I will be presenting to you a process by the name of Community Action for Health. This is a community-based research and action for strengthening the public health system and is under the umbrella program of the Government of India called the National Rural Health Mission. As part of this National Rural Health Mission, a number of civil society organizations like mine have come forward to partner with the government to actualize the concept of communitization, which forms one of the pillars of the mission. Before I start my presentation, I would like to tell you a small story. There was a village in Dharmapuri district of Tamil Nadu where there was a primary health center. But despite having doctors, nurses, equipment, and a well-functioning maternity benefit scheme, there were no deliveries taking place in that hospital. 9 months ago, thanks to a process that explored the reasons for people not accessing this system, groups of people from the village, the doctor, the nurse, health workers, civil society animators, and the local elected representative met together to discuss the problem. The gap was discussed, and it came about that the lack of running water was the main cause for people not accessing the services in this hospital. The local elected representative immediately visited the hospital for the first time, and this very soon led to that facility getting running water. Today, almost 9 months later, this facility is reporting among the highest number of deliveries in this district. Community action for health. The process promises to facilitate and create the space for such learning and strengthening of the health system. As seen from the story, community action for health is essentially about measuring a gap, the gap between the current status of health services and the desired status of health services. This gap is measured by the process of monitoring. The information gathered during this monitoring is fed back into the system to the level at which there is power to make the change. It is hoped that this feedback will lead to corrective action and the evolution of a strategy to shorten or make this gap less. In the presentation, I will dissect this concept map to take you to the process, to take you through the questions. Who does the monitoring? How do they measure the gap? How do they feed back to the system? What are the types of action that occur at the village level? And how do we feed back to the policy level? The first question is, who does this monitoring? This monitoring takes place through village committees. Village committees are formed with the help of civil society animators that go to the different parts of the village, to different hamlets in the village, and explain the process to the community members, who then nominate from amongst themselves people whom they feel would be members who could represent themselves. After this, the committee members are oriented and trained. They are oriented and trained with reference to concepts like accountability, rights, and their entitlements in the public health system. This is done by civil society groups who are part of this process. The next question is, how do they measure the gap? These committees then meet people who have used the healthcare service in the last 6 months. So, for example, they meet school children who are supposed to have undergone the school health program. They meet adults who may have gone to the primary health center for treatment. They meet mothers whose children are in the local government-run creche. They meet mothers who have just delivered or whose children would have had immunization, and collect feedback regarding those particular services from them. They use a specially evolved tool for this. This tool, projected here in the local language Tamil, has pre-prepared questions in the format that lead to yes and no answers. If the answer is yes, then it gets a green color. If the answer is no, it gets a red color. And if the beneficiary or the person answering is not so sure, and then they may get a yellow color. Apart from this, information is also collected from the facility. So we have created a tool with a visual representation of the different equipment that is supposed to be there in the primary health center. People take this list and go to the primary health center and look for that particular piece of equipment. If the equipment is there and it's working, it gets a green. If it's there and it's not working, it gets a yellow. And if it's not there, it gets a red. In this way, people are able to measure a gap and bring it into a visual format. The information on the services monitoring tool and the facilities monitoring tool feed in to the village health report card, which in one sheet gives the villagers an information about the way the health system is perceived to be working by people who've used the health system. The next question is, how is this information used? This information is used, as I have said before, by feeding back into the health system. How do they feed back into the system? This is done through the village health planning day. On this day, people from the village, NGO facilitators, local government representatives, doctors, nurses, and others gather together. In this photograph, you can see in the background the village health report card has been displayed, and people are discussing what has been represented. And what do they do in this meeting? The planning principle is very simple. People try and answer the following. How can we turn a service assessed as red into green in 6 months together? And what happens? We have seen that at the village level, this information leads to a number of very exciting outcomes. We have seen a lot of discussion of these report cards at the village level. This has led, in hard terms, into improvements in services available at the village level. For example, if we look at this graph, which shows the proportion of people answering green to the question of availability of postnatal services, you will notice that between round 1 and round 2, which were about 6 months apart, there has been a significant improvement in the availability of postnatal services. Similarly, this graph shows that there has been an improvement in the quality of postnatal services. This is merely to say that this feedback of information into the health system seem to have improved both the quantity and the quality of healthcare services people were getting. Not only that, we have seen anecdotal uh, evidences of better working hours, improved privacy for people who were getting injections, for example, availability of needles and syringes improving at a number of health facilities. We also have collected examples of village committee members being part of epidemic surveillances and also leading to an increased demand of public health services. Most importantly, these committees have shown the way of working on social determinants of health by taking up issues of cleaning the water tanks, for example, making sure that they were warm and tasty school noon meals, as well as taking up issues of sewage disposal. How is this information transmitted to the policy level? We have developed a system by which this information is transmitted through a simple text SMS into a central server. Here it is converted into a consolidated district level report card with the same information. This district level report card is fed back to the district officials, and here we see a discussion between the district elected representative, the district official from the public health system, and representatives of the civil society and village heads who are having a discussion around this this consolidated report card. It is hoped that this sort of policy feedback, as well as village level feedback and action, will lead to corrective action, and that this corrective action will ultimately close the gap. This is an exciting process, but it leaves a lot of challenges to its upscaling. And some of them are: how do we move from being an NGO project into a systemic intervention? How do we get the system to own this process? How do we upscale an empowering process that requires time and problem solving rather than standardized inputs? How do we convince the system to share power with the people? And how do we convince the people of the feasibility of demanding accountability from a system that has traditionally dealt with it in terms of patronage and populism? Thank you.